The most common misconception is that a cataract is a film or a membrane or something that I peel away. Cataract's not a growth on or in the lens, it is the lens. And once a lens is yellow and clouded, we have no way of unyellowing it or unclouding it. So that's probably the most common myth, that cataract surgery is the peeling of a membrane or a tissue, when in reality it's the replacement of that cloudy lens which no longer works. We take it out, throw it away, and in its place we put a replacement lens. Another very common misconception about cataracts is that cataract surgery is uncomfortable or painful. The reality is that cataract surgery is probably the easiest procedure you can ever go through, while also providing potentially the biggest change in your ability to function. The procedure's over in minutes, and it's done with the patient awake but relaxed. And when it's done, there's no patch or shield over their eye, and they're on their way to the recovery room. Probably within 10 minutes, they're on their way home. One of the questions that I'm asked most frequently by patients is, will my cataract return? And the answer is no. The human lens, the cataract in this case, sits in a capsule. And when we remove the cataract from that capsule. And then we place the replacement lens in that same capsule. Over time, that capsule can get hazy or cloudy just from natural healing. But rather than having to go to the operating room to do anything, we simply take the patient back to a laser in my office, and in a procedure that literally takes a minute or so, we make an opening in the back of that capsule, zap, 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 the laser does it. The patient goes home as though nothing happened. It was as easy as getting their eyes tested. There's no restrictions on their activities. And that's as close as one can get to getting a cataract back again. Cataracts don't wait until you're older before they start to affect you. The average age for cataract surgery in my practice a number of years ago was 64, and I still operate on the 80 and 90-year-olds, which means that a lot of people are having their cataracts removed much earlier than 64, and that's not uncommon. So it's weekly that I'm taking cataracts out of people that are affecting how they see in their 50s, sometimes even in their 40s, occasionally even in their 30s, but as you get younger and younger, they're really much more rare. Cataracts can come from trauma, they can come from certain disease states, they can come from infections, they can come from inflammation, they can come from medication. So there are reasons why someone might get a cataract earlier rather than later. And some people are actually born with cataracts. Those are the congenital cataracts that infants can have. Patients do often come in earlier than they would think with impairment in the quality of their vision and how they function and how they can see, that is directly related to the aging of that human lens. And if they have that human lens removed at that age, they'll be able to see better then, rather than waiting till they're 60, 70, or 80, unless they choose to wait. Cataracts rarely cause harm to the eye. They just impair the quality of the picture.